you need to do brain surgery on a tumor that's very deep within the brain, how do you get to it? One deep area of the brain where tumors sometimes arise is what we call the pineal region. What I have here is a diagram where what I've shown in red is a diagram of a tumor in the pineal region. This is the region of the brain where the pineal gland is. One of the first decisions and most important that you need to make as a neurosurgeon when you're planning brain tumor surgery is your approach. What is your operative corridor? The three most common operative corridors to reach tumors in the pineal region are diagrammed behind me. There is what we call the supracerebellar infratentorial approach. Right here, I diagrammed the interhemispheric transtentorial approach. And then there is the interhemispheric transsplenial approach. Your choice between these three options takes into account just very subtle differences in the location of this brain tumor and what anatomy is going to be in your way. Because when you're doing brain surgery, you want to position the patient and make your approach such that things that you don't want in your operative corridor, you can use gravity to get out of your way, or you can make sure that there is some safe path to get there. The names of these approaches actually tell you the operative corridor that you're taking. So for the supracerebellar infratentorial approach, that just means going above the cerebellum and below the tentorium. The tentorium is this dural plane right here that divides the posterior fossa where the cerebellum sits from the supratentorial region, which is where the occipital lobe is, right over here. You make your craniotomy, your hole in the bone here. Basically, there is a potential space right here that you open up in order to get to the tumor. Both of these approaches up here are actually, you can't tell by the sagittal diagram, but they're actually going between the hemispheres of the brain. And if the tumor is a little bit lower, sometimes you need to actually divide and go through the tentorium. The interhemispheric transsplenial approach takes into account things that may be out of reach of both of those, and so you go between the hemispheres, and sometimes you need to divide some of the splenium, which is the posterior aspect of the corpus callosum, because it will likely be blocking your view, and typically you can divide a part of it without causing serious deficits to reach these pineal region tumors. That's just a summary of a few of the general approaches to pineal region tumors.